advancements in digital dentistry, and how do you think it will impact the future of dental practice?
So there are a couple of things. I would say the first one is the level of automation that will come. This is mainly artificial intelligence applied to many use cases. So what we'll see in the next years is more friendly technology, most likely. Second one is individual patient data being used more and more. So biometric data like patient's shape of teeth, patient's motion, patient's bone, patient's condyles, patient's everything. And I believe that just creates the possibility of having more individualized, more customized planning. Yeah. These two, I think, are the most important for me.
Oh, how do I see the future, how it will be impacting implant practice? So this is now the edge when everything is changing to technologies. And this is what we have to take as advantage. And sometimes we discuss if artificial intelligence robots will change us. I don't believe in that. I think that our profession will last for long years. Just we need to implement all these advantages of all these technological advantages into our daily practice, and it will be much easier for us to achieve a much better result.
As an esteemed practitioner in the field, what advice would you give to the young dentists and students who are interested in digital dentistry? Are there any specific skills or experience they should focus on?
No, just keep an open mind. Yeah, keep an open mind. Use your common sense, try out things, and probably get a mentor to guide you a little bit. That would also help, because at the beginning everything looks nice. You need a certain level of experience to be able to distill the huge amount of information that you are exposed to.
For my younger colleagues, I would advise really not to stop to educate yourself, and just visit different courses, conferences, readings, papers, publications, also books. So our profession is really very interesting, but we have to be all the time on the wave, right? Just we have to learn all the time. So do not stop learning.
If attendees leave your lecture with just one thing stuck in their heads, what would you want it to be?
That's a tough one. Well, I just always want to, first of all, as an energy, I want to give people the energy and the proof of concept that it is possible, whatever I'm talking about. So that's number one, that they can. That's number two, ideally. So one, I always try. Second one, if I do very well, sometimes I manage. And number three is again, I really try to do it in a way that I leave some dots, sometimes intentionally, sometimes by accident, but I really try to engage the audience in feeling those in, to create a sort of an active experience. The rest depends, I guess, on the specific topic that I'm talking about, but at least in terms of doing things, is what I try to do.
Thank you.
Whole message from my lecture, I think. So, but perhaps the most important thing is planning and correct 3D positioning of implant. And as I said in lecture, if even we fail with a bone augmentation, with soft tissue grafting, with something else, if something goes wrong, having implant in correct 3D position, we will be able to correct it. And we will end up finally with a good final aesthetic result. So this is maybe the most important point.
Thank you very much.